Hello, I'm Dr. Mark Frye, and I'm a psychiatrist at Mayo Clinic. We all experience the emotional ups and downs of life. But when these mood swings become extreme, change suddenly, and negatively impact our function and our quality of life, it may be due to a mental health condition called bipolar disorder. Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings, including emotional highs and lows, with an associated marked change in energy. During an emotional high, you may feel euphoric or unusually irritable. Importantly, the corresponding energy change can be highly productive or unusually impulsive. This is called mania. A less severe form is called hypomania. During an emotional low, also called depression, you may feel sad, hopeless, apathetic, or have thoughts that life is not worth living. Again, the corresponding energy change can be prominent lethargy, feeling exhausted, sometimes an inability to get out of bed. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Both episodes of mania and depression can cause great difficulty with work, school, social activities, and our relationships. Bipolar disorder affects more than 5 million adult Americans every year. The average age of illness onset is about 25, but it can occur in adolescence or late life. In contrast to major depression, bipolar disorder affects men and women equally. Individuals with bipolar disorder appear to have brain changes, and it's more common in people who have a sibling or parent with the condition. Symptoms may include mania, hypomania, and depression. Episodes of mood swings may occur rarely or multiple times a year. Most people experience emotional symptoms between episodes, while some may not. There are two main types of bipolar disorder. Bipolar type 1 disorder means an individual has had at some point in the past a manic episode. In some cases, mania may trigger a break from reality, also known as psychosis. With bipolar type 2 disorder, an individual has had at least one hypomanic episode in the past, but never a manic episode. We rely on a thorough interview, asking questions about symptoms and history, as well as a physical exam, additional psychiatric assessments, and/or mood tracking. Although bipolar disorder is a lifelong condition, symptoms can be very effectively managed. In most cases, bipolar disorder is treated with medications and counseling. Bipolar disorder doesn't get better on its own. If you have any symptoms of depression or mania, please see your doctor or mental health professional. Suicidal thoughts are common among people with bipolar disorder. If you or someone you love is having suicidal thoughts, call 988, the Suicide and Crisis Lifeline. If you have a loved one who's in immediate danger of suicide, make sure someone stays with that person. Call 911 or your local emergency room number immediately. Or, if you can do so safely, take the person to the nearest hospital emergency room. If you're experiencing bipolar disorder, you are not alone. 1 in 25 Americans live with a serious mental illness, such as bipolar disorder, schizophrenia, or major depression. You don't have to struggle with mental health conditions by yourself. Reach out, seek help, find resources. Looking for more information about bipolar disorder? Visit mayoclinic.org.